The biggest challenge for a hospital to face in inventory management overall is the word inconsistency. It could be anything from different product codes from different manufacturers. It could be product codes altering, NDCs changing after expiration, and it's also the different pricing per drug. So as an outside inventory service, we are very aware of those inconsistencies, and we'll make sure that we can give you the best solution to give you the most accurate valuation. The difference between, let's say, a small localized pharmacy and a hospital pharmacy is through the various vendors that can be ordered and the type of invoicing that occurs. So it's another inconsistency or what have you. So usually with the hospital, you will have a centralized vendor and it's very straightforward. You'll have the product code, you'll have the valuation, but if you order something direct, it doesn't go through that centralized vendor. So therefore that creates a new problem where you might want to create an internal solution for. However, that internal solution could create another problem. For example, if you have a TNKs, which is a drug for stroke, and you decide to put it into a kit, it can no longer have the same part number. Once the part number has been altered, therefore there's not an automated way to attribute a valuation. At Monarch, we understand all these inconsistencies. We understand the attempts to solve them, and those attempts can be pitfalls and cause errors and further inconsistencies. At Monarch, we feel that we have the expert knowledge and know how to account for all that to give the most accurate value. When you're having someone do inventory for a hospital, you want them to have expert know-how. Why? Well, if you created in-house solutions to account for these inconsistencies, we've seen many hospitals, large, small, all have fairly similar attempts to solve for these inconsistencies. So we understand what's going on internally. We understand how you're trying to solve those inventory problems. And because we have the knowledge and the know-how, we can make sure that valuation is accurate compared to someone who doesn't have that expertise or knowledge.